Hello, my name is Carmela Cavoli. I'm presenting my CNL Presentation Nursing 613. My practicum was in Mills Peninsula Health Services. It's in 1501 Shrewsbury Drive in Burlingame, California. It's a general medical community hospital in Burlingame with 251 beds. It is the official destination for emergencies at the San Francisco International Airport. On an average day, this award-winning emergency department team treats more than 115 patients, administers critical care for stroke, heart attack, car accidents, sports injuries, poisoning, or any medical or psychiatric emergency. My preceptor is Jenny Fung. She has a bachelor's in nursing and a master's in an MBA. She's the official stroke coordinator of the hospital, oversees the MPHS Performance Improvement Plan, educates nurses at current evidence-based practice in stroke. Her experience is ER for 9 years and ICU for 2 years. The CNL role that I was able to achieve is according to the white paper, this advocate, which I work with interdisciplinary teams by communicating effectively to achieve quality status outcome by reviewing and evaluating patient care, guidelines, and protocol to implement it. I reviewed and evaluate the stroke quality measuring tool and assist nurses in assessing new diagnosed stroke patients. I also was a member of a profession and what affects change. Example is a nursing quality council. I was able to attend one of the meetings, which meets every month and evaluates nursing practice at the hospital. Also, I was an information manager, which I was able to use information system as point of care to improve patient outcome by evaluating the stroke quality measurement tool on the nursing staff. An example was asking the nurse's opinion about the quality tool to make it helpful for them in implementing the changes. Another is a clinician, help promoted by assessing stroke patients by discharge, assessing according to the quality measure tool if the patient has statins, anticoagulants, or antithrombotic by discharge. Also an educator using appropriate learning practice and other and strategies to clients and other healthcare professionals by educating them and plan for the ICU. The plus and minuses was I was able to see the process of how a stroke patient is assessed from admission to discharge and look into the data involved in the importance of quality measure tool for chart review and ensure the stroke patients are meeting evidence-based quality measures for outcomes. And I was able to meet with the head educator of MPHS, my preceptor's mentor. The minuses is not enough time to see the outcome of revised quality measure tool. And the first time my preceptor was precepting and my objectives were revised to correlate with the CNL objectives in the syllabus. And one more minus is I work at this hospital and my peers were asking me why I was wearing the white jacket. Reflection is the goals that I have set for myself was too high and given the short period of time allotted. Some of the objectives were met, although I was not able to get the feedback of what the nurses in ICU thought of the revised quality tool. My preceptor has set up a meeting with the head educator, and my objectives were changed to correlate with the objectives of CNL 613 syllabus. I had to differentiate the roles of CNL, CNS, NP, and RN. I interviewed an NP and CNS. I had to do a presentation in front of a panel, but due to time constraints, I will present it to my preceptor next week. I would have wished I met the head educator in the beginning so I could have had enough time to do my research. In the future, I would want to go to the cardiovascular aspect and allot enough hours for each objective that I've set for myself. The aha moment for me was when my preceptor said, "Once you are that white coat, be a master, prepared nurse. You are not a nurse, but a CNL. Portray the role and embrace that role." And that was really an aha for me. And another one is I interviewed the CNS, who did not realize how I actually did not realize that knowledge is shared and mentoring is natural to some. According to Harris and Russell, both communication and critical thinking skills are identified as essential for successful preceptorship and evaluate using tools such as the Boyer's evaluation of practice criteria or the 1-minute preceptor model, which could have been useful for me. Thank you, and this is my reference.